Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman. In what's being described as the first major setback of Barack Obama's presidency, Tom Daschle withdrew his nomination as Secretary of Health and Human Services Tuesday after a firestorm over his failure to pay tens of thousands of dollars in personal taxes. The news came just 2 hours after President Obama's nominee to be Chief White House Performance Officer, Nancy Killefer, also withdrew her name because of unpaid payroll taxes for a household employee. The administration had initially ignored criticism of Daschle after the disclosure last Friday that he had not paid more than $126,000 in taxes for the use of a friend's chauffeur and car service. As recently as Monday, President Obama had pledged his full support for the former Democratic Senate Majority Leader, who was widely expected to be confirmed. But by Tuesday morning, Daschle told the president he believed his tax lapses had become a distraction. In a statement, he said he would not have been able to lead an overhaul of the nation's health care system, quote, with the full faith of the Congress and the American people. In a series of Oval Office interviews on broadcast and cable television networks last night, President Obama acknowledged he had made a mistake and said he took responsibility for the errors. This is what he had to say on CNN's Anderson Cooper 360.
Made an assessment that having made a mistake on his taxes that he took responsibility for and indicated was a mistake, made the assessment that he was going to be too much of a distraction in trying to lead what is going to be a very heavy lift, trying to deliver health care. And
do you feel you messed up in letting it get this far?
Yes, I think I made a mistake, and I told Tom that. I take responsibility for the appointees.
What was your mistake, letting it get this far? You should have pulled it earlier?
Well, I think my mistake is not in selecting Tom originally, because I think nobody was better equipped to deal both with the substance and policy of health care. He understands it as well as anybody, but also the politics, which is going to be required to actually get it done.
The White House is considering replacing Daschle with two people. He had negotiated a special arrangement to serve in the cabinet as Secretary of Health and Human Services, while also serving as director of a new White House Office of Health Reform. The New York Times described Daschle as an unusually well-positioned architect for a big legislative campaign to expand health care. Daschle served 10 years as the Democratic leader in the Senate as part of a 26-year legislative career. After leaving Congress, he became a leading champion of health care reform. He also represented health care clients for his law firm, and he received more than $250,000 in income from paid speeches and advice given to corporations in the health care sector. Among the people mentioned as possible candidates for the job of health secretary are Governor Kathleen Sebelius of Kansas, former Governor John Kitzhaber of Oregon, and Governor Jennifer Granholm of Michigan. For more, we're joined right now by Richard Kirsch, the National Campaign Manager of Healthcare for America Now. We welcome you to Democracy Now!
Great to be here with you this morning, Amy.
Well, first start off by responding to what's happened to Tom Daschle and the significance of this for healthcare reform.
Well, I don't think it significantly will impede winning health care reform because there's such momentum and such commitment from the White House and congressional leadership. Having said that, as you just heard President Obama say, there were ways that Tom Daschle was uniquely equipped for the job. The thing about health care is that the policy and politics of health care are really intertwined very closely. And he does understand health care policy very well. And as a former Senate Majority Leader, he understands politics in Washington. So he was the first obvious choice for the job. He's someone who backed Senator Barham early in the campaign. But again, he's gone, and the real fact is that Obama is very strongly committed to getting health care done in 2009. The Senate Finance Chair, Max Baucus, is. Ted Kennedy is. We just heard this week Henry Waxman, who's the new Chair of Energy and Commerce in the House, being committed. And that's what really matters. And then the other thing that matters is this is a pressing issue that the American public really is demanding action on.
Now, Richard Kirsch, there are two issues here. One is his failure to pay over $100,000 in taxes. But talk about the other issue of where Tom Daschle went after he left the Senate, who he represented, where he made his money.
Well, it wasn't exclusively this, but he had a lot of clients. He worked for a law firm. He worked for an investment firm. And some of his clients were in the healthcare industry, and he did some speeches in front of the healthcare industry. And, that also was an issue that wasn't disqualifying him, but they were raising some eyebrows.
You're talking insurance companies?
Insurance companies were among those. Having said that, I don't think that was really clouding his judgment in the job. I mean, the president's plan, which he put forth in the campaign, calls for two things. It calls for very strict regulation of the private insurance industry, and it calls for the establishment of a new public health insurance plan that would basically compete with private insurers and allow people to have insurance that's not reliant on private insurance. And Senator Daschle was very firmly committed to those principles, and he really understands all the politics. So I think that while, it would have been better if he hadn't had those clients, I don't think it clouded his ability to make judgments about the right kind of policies we needed.
What about other senators and Congress members, the power of the health insurance industry in lobbying to prevent health care reform?
Well, it's huge. And, the debate this year is really going to come down to whether or not the insurance industry can block the kind of health care reform that's really meaningful. A great example was the insurance industry lobby, and I love their name. They call themselves America's Health Insurance Plans, like they're ours. Unfortunately, they're too much ours. They came up with a plan, and on page 9 of their plan, it says, if you go medically bankrupt under our plan and you're of moderate income, we'll give you some tax credits so you don't go bankrupt. We thought the purpose of health care reform was to stop medical bankruptcy, not to allow it to continue to happen and then get some government relief. The insurance industry will putting out these plans that continue to let them charge whatever they want, allow them to have high deductibles, sign their own benefits. And they're going to, they're not saying this year like they did in 93, 94, don't do health insurance reform. They're saying do it our way, which was a way that will really be bad for people. So it's a huge lobby. And what our whole goal at Healthcare for America now is to build up the grassroots campaign that'll really make it clear that Americans want a healthcare system that doesn't put insurance company profits before our health.
Richard Kirsch, what do you see as doable in this 4 years? I mean, Americans are right now going through a mass crisis like we haven't seen for decades, perhaps even 75 years. We're not only talking about record levels of unemployment that'll add to the pressure around the issue of health care. You've got the auto industry going under, the auto industry competing with companies around the world that come from single-payer health countries or countries where there is health care for everyone, so the companies themselves just don't have to pay it. What can you see happening now?
Well, it's not just 4 years. I actually think it's this year. I mean, President Obama said back in December that in 2009 he wanted to see accessible, affordable health coverage for every American. The administration and the leadership in Congress believes that 2009 is the year to do it. So, and what they're looking for is passing legislation that will guarantee everyone affordable coverage, coverage that's good, and also coverage that has a choice of either highly regulated private insurance or a public health insurance plan, so you're not just stuck with private insurance. That's what their goals are. That's actually what the goals of our campaign are, and 2009 is the year. And I think to believe, in terms of the question of the crisis, which you raised, Amy, this is really an opportunity in terms of American history. There's a guy named Mike Lux who just published a book called The Progressive Revolution, How the Best in America Came to Be. And he talks about 3 things you need to have to make the kind of historic changes that have reshaped our country for, 2 centuries, whether it's what happened in the Civil War or the Progressive Movement or the New Deal or the Great Society and the Civil Rights Movement. 1 is you need a crisis, and we have that crisis. 2 is you need a leader that's open to change, and clearly that was the central theme of President Obama's campaign. And 3 is you need a movement. And there's a lot of movement. We saw movement in the campaign. There's a huge movement behind people who want to get health care. And really, it's making that movement so that Congress stands up to the health insurance industry and the drug companies. The others are going to want to block change.
And how do you see this not being a reprise of when Hillary Clinton, as First Lady, was in charge of reforming health care?
We've learned a lot. I mean, it's true that the health insurance crisis has gotten worse the last 16 years, and that even groups before that said we could not do it, like major parts of the business community, are now saying we have to do something. We've also learned a lot about building a huge base. Our organization, Healthcare for America Now, includes the largest progressive forces in the country, the biggest unions, online groups like Move On, community-based networks. We've got more than 700 organizations, 100 organized around the country. There wasn't that kind of really well-organized grassroots movement. We're also advocating for a set of specific changes that will solve the policy problem. Last time when President Clinton tried it, he called for something called managed competition. No one knew what it was. It really scared people. We've been developing for several years an approach that really will actually provide good quality coverage and also that can win the support of American people. Again, a guaranteed choice of health care that's affordable, benefits that meet your needs from a choice of a private or public health insurance plan. So we've learned a